This is part 2. We just spent 5 minutes bringing the distal femur forward and blocking the distal tibia. And I'm now able to impart some spring. I'm going to test hyperextension. That's improved. I'm going to test patellar mobility. And I can glide it side to side. It's much freer, and I can come underneath it somewhat. Not quite as free as the other side. And I'm going to test AP spring, and I can spring that distal femur now. So let's have you lie on your stomach and let's look at how much it bends. So the left knee, you'll recall, we could bend it to about 115, 110, 115 degrees. And so we'll call that the normal side. This one was restricted to about 95. And you'll notice that they're now equal. Very nice. Can you tell that's freer?
Mm-hmm.
Okay. Let's have you step down and walk around. I'll give you some feedback.
So where do you want me to walk?
I'll just walk up and down in there, out there, where there's more room. Any thoughts?
Yeah, it feels better.
How so?
I don't know, more balanced, more.
Can you try some of those yoga postures?
Let's see.
Squatting and such?
Let's see here. So, yeah, I still feel it. Like I almost have a limitation there, but I feel like I could go a bit past it this time.
Uh-huh.
I guess the one I would also used to do is this one. Well, this is the good knee. Bringing it up.
What's the name of that pose?
I can't remember what. I can't remember it. But it does feel more even.
Okay.
Before, yeah. I used to always have to really think about this side.
Uh-huh.
Even trying to get into it. And I think it used to be actually tighter than what you saw today.
Oh, okay.
Yeah.
Very good. So it feels to me like it could gain a little bit more.
Mm-hmm.
It doesn't feel quite as equal to the other side.
Right.
So I do want to continue to work on it. And it might be that a little bit of subtle work on the hip and some work on the ankle may feed into the knee being a little bit freer.
Okay.
So I'll stop filming here. Mm-hmm. And I thank you because you're the third person in 3 weeks
who
presents with this pattern. I think it's an important one. I don't think it's necessarily on everybody's radar.
Okay.
You know, in terms of evaluating for it and treating it.
Mm-hmm.
So it would make for a good study down the road.
Oh, good.
Thank you so much.
Very good.